So to begin with the session officially, I would like to invite Dr. Punsachadan, who is the Chair of Evaluation Association of Bhutan and board member for the Community of Evaluators, to kindly make your way on the stage and deliver the opening remarks.
Good Sangpo and good day to everyone. On behalf of the Community of Evaluators South Asia and Evaluation Association of Bhutan, I would like to extend my sincere welcome to our distinguished keynote speakers, Madam Mary Counseling, Deputy Representative of UNICEF Bhutan, Mr. Narbhadur Raika, Education Specialist from the Ministry of Education, the two most important organizations for all of us here. And thank you for accepting to speak for us today. And our panelists for the day, we have Dr. Chanda Shekhar Dhaka, Mr. Tashitendu, Mr. Tashituba, Madam Song Tashi, and Dr. Salah Boyers P, who will be speaking virtually from Morocco. And our skill trainers for the day, Dr. Sonam Sering and Mr. Chimidoji, and all our eager participants here who are keenly waiting for the event to unfold. I welcome all of you to this fifth evaluation conclave of Community of Evaluators South Asia. I'll come back after a long COVID break. Welcome all of you to this event. And this year, EAB is particularly delighted to get this opportunity to co-host a part of this conclave here in Thimphu. And today is the last and the final day of 3-day conclave, which took off on 12 in New Delhi. And yesterday it was held physically in Kathmandu, Nepal, and Dhaka in Bangladesh. And today we are here in Thimphu and Colombo in Sri Lanka. And as we attend the program physically, there are many who are also speaking, who are also listening or going virtual from different parts of the world. And I also extend my sincere welcome to all of them to the event. And this year our conclave took the theme on equity and transformation, which is challenging times, evaluation in challenging times, which is a time-relevant theme as we are all embracing the change and transformation. The COVID-19 being a good example of this put in one challenging times, change, transformation, equity issues, and the list could go on. As we undergo the transformation and change, one thing we all must remember is the equity issue, which is crucial as we journey towards our global goal of leaving no one behind in the development. As a good and timely evaluation is meant to help us making sure that no one is left behind and ensure equity as we transform. By good evaluation, what I mean here is evaluation that is for the people, by the people, and with the people, that is being promoted by the principles of culturally responsive evaluation. And this calls for an evaluation to be relevant to the people, not only for the funders, and credible, and also ethical and culturally responsive, and based on the local wisdom. And by timely evaluation, I mean evaluation must become an integral part of the development processes, not a one-time event. And this system of evaluation is what we all must endeavor to build on, and in order to achieve a wholesome and meaningful transformation that benefits everyone. Today, our day-long course will focus around this conclave theme and also remind ourselves of our greater global goal along with our local concerns. With this, I would once again invite, welcome all of you, and pray that our day-long discourse is meaningful and all of us can take valuable lesson from it. Thank you and Kadinchi.
Thank you, Dr. Pinsol. Let me now introduce to our first keynote speaker, Ms. Mary Conclave. Ms. Mary Conclave is the Deputy Representative of UNICEF in Bhutan. She has more than 20 years of experience in program management and strategic leadership, serving the children of the world in countries like Angola, Benin, and Bhutan, to name few. Ms. Mary provides strategic, intellectual, and operational leadership in planning, implementing, and monitoring activities with a logical and methodical approach to achieving tasks and objectives. With this, I would like to welcome Ms. Mary Conclave to speak on the topic evaluation in times of crisis.
So, Kuzuzampola. Kuzuzampola. Oh, that's better. Thank you. Good morning to the online participants. I'm told I need to speak very close to the mic, so I'll try my best. I'm very happy to be here this morning and address all of you. It's actually an honor because you're the brain behind the evidence generation. And without evidence, I don't think we can make any policy, right? Without evidence, we cannot support better our population. And in my particular case, the most vulnerable, the children. So I hope the presentation we have prepared for you is going to speak to you and maybe enlighten a little bit your spectrum. I see a lot of young faces here, and for me, it's really a blessing, especially when I have to address younger generations. Well, I'm a bit older, because I know that that's how we can perpetrate, knowledge and share and make sure that there is a legacy that continues. So again, good morning. So I'll be making a presentation on two specific areas. One is how to evaluate in time of crisis. And then the other part is how to evaluate for policy, right? So, yes, so if we can go to the first slide. So evaluating in time of crisis requires several steps because we need to have a very strong and systematic assessment methodology of any program that we are operating for. And when we are evaluating in time of crisis, we are also looking at the level of achievement of both expected but also unexpected results by looking at the result chain, the different processes, the contextual factors, and the causalities using appropriate criteria such as relevance, effectiveness, efficiency, impact, and sustainability. Quality evaluation also would help us to determine what works well, what could be improved in a program or initiative as we respond to any crisis of any scale and impact. So you can see that we've shared with you here, there's a link a little bit below on the norms and standards for evaluation that you can have access to if you don't have it, and then kind of understand a little bit better what we understand for evaluation. So when we look at evaluating in a time of crisis, this is the next slide, we have to make sure that this is an inclusive process. Because I think you just mentioned, Executive Director just mentioned here the importance of equity, but I also think that the importance of inclusiveness is to be taken into account, because we want to make sure that in that process, when we are evaluating, all people, mostly children who are vulnerable, are included as much as possible. It has to be an honest and accountable process because we want to kind of make sure that we are responding to the needs of the affected population. And it has to be replicable because what we are expecting in such a process is that the methods are as rigorous as the circumstances allow as much as possible. And then lastly, evaluation evidence is based on a triangulation of data and information collected during the crisis. I don't know if you can read well what is there. So what are some of the critical elements of evaluating in time of crisis? There are three things, three components. The first one is to understand the complex system, the complex system of self-organized, and they are interdependent. The second is those complex systems keep evolving. So there is a process that keeps going. And then this complex systems are not linear. So if I speak to the first point, individuals interpret signals from each other part of the system and respond accordingly. While there may be rules, it is not possible to predict with 100% certainty how the individual may be responding. And the second one, when we are evaluating the time of crisis, we need to make and take into account the fact that individuals in the system may make choices which collectively can display emergent properties. And lastly, the collective behavioral outcome of the system emerges from the nonlinear interaction, cause the whole to be greater than the sum of its parts. So this idea of the nonlinear kind of aspect when we are evaluating a time of crisis is an important element that we need to take into account when we are doing an evaluation in time of crisis. I'll be sharing with you a real case study, a little bit going down the presentation. So some of the characteristics of operating in environment during situation of crisis or emergency. There are four elements which I call VUCA. So they are volatile, they are uncertain, they are complex, and they are ambiguous. This is what characterizes a crisis and emergency. And therefore, when we talk about volatility, we are talking about events that are unexpected and for which a duration can really have an impact on the system and the norms that are already in place. We say that they are uncertain because these are events with unclear short-term and medium-term consequences. And when we speak about complexity, we kind of refer to events and issue which features and interrelations are very hard to understand. And lastly, ambiguous, which is the last element and characteristic, is that the event and issue marked may be contexted, hidden, and very difficult to kind of have some consistency in the information that is being collected. So how do we kind of work around methodologically to conduct an evaluation in time of crisis? It's very important to gather and synthesize rapid feedback from staff and community leaders on the front of the line of the response. Also making sure that real-time feedback from community members is guarded on their responses to change and support the strategies. We have to adapt. So if we're talking about real-time, we need to make sure that we are ready to shift to virtual data collection. So this flexibility is very important. And then facilitate intentional reflection on organizational remote culture. So these four elements are very important when we are looking at addressing an evaluation in times of crisis or in a situation of emergency. Next slide. Thank you. So I thought it would be good to kind of share with you a case study of evaluating in time of crisis. And what you see here is a real-time evaluation of gender integration in UNICEF COVID-19 response in the region of South Asia. Here we have all the 8 countries that have been evaluated. So far, I think the report is not available to the public, but as soon as it is, I think it's a document that we can share with you for reference and as an example of how you can actually undertake an evaluation in real time. So the evaluation process was to establish the operational preparedness of integrating gender and measuring gender effectiveness of the COVID response in the SAR region, and make sure that there was an accountability framework set up at the onset of the response. I'm sure this might resonate to you because we are part of the region. And the second objective of the evaluation was to assess up to what extent the gender had been integrated in the response measures. And the third element was to evaluate the gender effectiveness of the response measures by using the gender scale diagnostic tool against organizational regional priorities action, so that we could further improve how we were supporting the government in the response, and how we can align with government policies. And lastly, the whole exercise was really to kind of, share lesson learned, document good practices, look at bottlenecks, what worked, what did not work, and make sure that some of the successful initiatives that were happening at the regional level could help us improve how we are doing gender integration and our outcomes, even in a situation of crisis. So the evaluation methodology adopted a mixed method approach and blended quality analysis for gender and equity of the SIT reps. The SIT reps are the situation reports that we generate in a situation of crisis, which are regular, the response plans, the documents, interviews with quantitative analysis of some of our data, which is our system of collecting how we are progressing against the planned results, and some survey data. And the data collection tools that we have used included perception feedback surveys, semi-structured interviews, interactive peer reviews. And then the desk review included COVID-19 surveys and studies around the COVID-19 response in all the 8 countries. And case studies were learning focused and deep dives collaboratively with our country office in the 8 countries, looking at selecting some programmatic intervention using this gender lens to really look at how we can generate the lessons and look at the way forward in a case that we have another situation of emergency. So the scope of the evaluation was gender analysis of the COVID response, related normative framework data and programming. So it covered a sample of intervention from the 5 gender priority areas of UNICEF COVID-19 response. And the scope was also to ensure that gender data is available, analyzed, and actionable. And it took almost 9 months to undertake. And as I was mentioning, 8 South Asian countries were targeted in this study. Afghanistan, Bangladesh, Bhutan, India, Maldives, Nepal, Pakistan, and Sri Lanka. So this is really one of the most relevant case study that I thought you would be interested in finding out how we can actually make it happen in case of a situation of analysis. So hopefully we can, get you a copy as soon as it is, available, so you can kind of see how we have looked at, the gender lens and focus in time of an emergency, zooming in and taking into account the different scenarios of VUCA, the vulnerability, the ambiguity, the complexity, and so forth. And lastly, I'm not going to stop here, but we kind of had, a perception survey going on, key informant interview, focus group discussion. There was a blended mix of, online and virtual kind of exercise to make sure that we can collect the information that was needed. So what were the main findings? Frameworks included guidance document used in the early stage of the pandemic were swift, timely, and relevant to the immediate and urgent gender needs. So which means that in most of the countries, there was really a great, frameworks around, supporting the response, looking at the gender lens. Gender analysis was not a priority, with most of the response plan describing program, policy, and advocacy initiative being generic in response to COVID. Management support was found adequate and critical for a deeper gender response at the country level office. There were challenges in planning for response, measures that could lead to more transformational change on gender norms, roles, and responsibility. And the other finding was that the implementing partners had really different levels of gender and equity understanding, as well as expertise to implement programs that challenge gender structural inequities even before the pandemic. And for our governance, we actively advocated for gender priority to host governments during the COVID-19. So this evaluation really helped us kind of look at where the gaps were and where we could, kind of push the agenda better. There were challenges in uniform tracking and use of gender intersectorial data, as well as internal operational system, to ensure that there was synergy in the planning process during the implementation phases and evaluation of gender outcomes across all the sectors. And then descriptive evidence of inequities, such as digital divide, vulnerabilities of girls and boys leading to dropping out of school, increased child marriage, and gender-based violence were also captured in the report. So some key recommendations that came out, the need to allocate additional and enhance existing gender resources, human, but also technical, especially for monitoring and evaluation around gender effectiveness. Hence, for us, the whole importance of this sixth recommendation is, how do we leverage as UNICEF our comparative advantage with community level and sector programming and with the government to really make sure that we are integrating and embedding this gender programmatic lens in every single program that we're doing, in particular during an emergency or a crisis. And then the whole importance of developing externally verifiable measures, measurement system for gender-related influence and advocacy efforts with government. The importance of, tailoring capacity building for conceptual coherence of gender concepts and indicators, which are really much related to gender transformative change, both within but also beyond, to make sure that the diverse partners are also on the table. And strengthening result-based management of gender responsive and transformative programming was also a very important recommendation, so that we can see how we can, improve the outcome level tracking and regular feedback loops for programming. So how do we improve how we are working, and enhance the use of feminist frameworks and principles in our own programming, planning, and implementation. And lastly, strengthen and broaden partnership with communities, the different networks working around gender issues, movements in a strategic and programmatic way. So I will stop there for how to kind of look at evaluation in times of crisis and what is it that we've learned from that experience, and touch upon very briefly on evaluation of public policies. I'm sure there will be question and answers after this session, so we'll be happy to take those questions. So looking at evaluation, if you can move to the next slide. Thank you. Evaluation of public policies. Policy evaluation applies evaluation principles and methods to examine the content, implementation, or impact of any given policy. So evaluation is the activity through which we will develop an understanding of the merit, the worth, and utility of a policy. There is a link here. When you get the presentation, you can go a little bit deeper into the rationale. It's a sort of a guidance that you can go through and kind of understand a little bit better. But what I would like to touch upon is why evaluate public policies and why is it important? And so there are 10 elements that we thought were important to bring to the table. We want to evaluate public policies first to support and enhance compliance with existing policies. Second, to inform future policies. I think this is a critical element for us to see whether this policy is really meaningful or not. When we evaluate public policies, we're also ensuring that rules and regulations that are developed are done in such a participatory manner as much as possible. It is also important for any public investment, exercise. It's good for public education and communication. It provides us with a mechanism for accountability for all the resources that we are actually investing as a government. It helps to document policy development. It demonstrates impact and the value of this policy itself, and it serves as an evidence-based document to help, in the decision making. So looking at how the policy evaluation helps us further understand and manage, if we can move to the next slide. Thank you. So when we are looking at policy evaluation, we want to kind of understand better some of the inconsistencies between program design and implementation. So we want to kind of address that and deal with those inconsistencies to be more efficient. We also are looking at gathering data to support information. As mentioned earlier, evidence generation is a key and core element of how best we can do to implement a policy. Some of the policies often are very vague and do not actually do a favor to the government in terms of, how they are going to have an impact on the population and on the issue being discussed. So this evaluation will help assess all of these different elements which are important and, make some recommendation to improve the policy. So one other element that I think is important, the policy evaluation process helps us to work out of details, meaning revising or developing administrative guidelines and procedure for the policy. It will also help us further understand and manage the mismatch between mandate and resources that are needed for implementation, as I was mentioning a little bit earlier. And it will give us a certain leveraging on our negotiation skills for specific, intervention that we're looking at. And it's actually a very good, a document that can help the policymaker and the stakeholders as an element of evidence of what's working and what's not. And lastly, it can support any, strategies, including communication, when it's a strong exercise and the recommendations are well articulated. So that said, I wanted also to kind of share a little bit some of the evaluations that we have undertaken with, yes, next slide, with the government. Just as some example, you have two here. One is on the disability. This one is, I think, available now, Deshan, yes, and can be shared with you. And then the second one is on early childhood care and development program for UNICEF with the Ministry of Education, which I think was a first in the country. And this both evaluation will be critical for us as we are embarking in the new, for us, of course, and the government, but as we're embarking in our new country program development process for the new 5-year cycle for UNICEF, the finding and recommendation that were articulated in both reports will help not only at the policy level, but also how to optimize our resources and how to reach out to the most vulnerable already far to reach children with adequate, guidance and policies as we move along. Yeah. So I think this speaks for itself. I'm sure in the room we have different ministries, representative, different stakeholders, and we can't dream of, having a healthy evaluation environment if we're not working together. Thank you very much.
Thank you, Ms. Mary, for highlighting the critical elements in evaluation in crisis, the characteristics and methodologies used in order to conduct evaluation during the crisis. Dasula, with this, do we have any questions from the floor? We'll take the question and answers for this presentation.
Was too much information or too quick? Yes.
How much are these? Hello, Kezang from Bhutan. I just wanted to understand how much of this crisis M&E content is getting aligned into our 5-year plans through the gross national happiness and other stakeholders. Of course, UNICEF has been at the forefront of driving this M&E frameworks and systems in Bhutan as well. So just wondering what's happening as we get closer to the next 5-year plan.
Can I take another question, if there is, and then maybe try to address some of those questions? Okay, online? No, I can't see.
Where we are talking about where you talked about the equity and inclusive, and there you talked about gender, how the gender study was conducted in the region, right?
Yes.
So I'm interested to know, like, when you talk about the gender, gender is no more a binary, right? Now
Yeah.
It is a spectrum of gender. So I was wondering how much of that spectrum has been captured in this study. Thank you.
Thank you very much. So on the first question, I will try the best I can to address. When we evaluate, we obviously expect to get some recommendations as to what has worked and what has not worked, and how can this help us improve the way we are responding to COVID-19 response. So once we get the recommendation, it's our duty to reach out to our government counterparts or implementing partners and together look at how we can mainstream some of those recommendations to improve the way we're going to be responding to the next crisis. So yes, those recommendations are not for UNICEF, because UNICEF or any other UN agencies, we are in a country because we are hosted by the government to support their, government plan. Hence, as we are moving into the planning phase now of our new country program, and as we are actually looking at ways to be more predictable in case of any crisis, pandemic, any situation that would come, we have taken certain steps with the government to look at how we can address some of these recommendations. One specific one is the current process of, developing a kind of strategy, public finance strategies for the health ministry in case of a crisis. So that's one of the kind of recommendation, and that's how we act on it. So if that is one recommendation, to look at how we are sustainable in responding to some of these pandemics, for example, is to look at what are the mechanisms in the country, especially at the Ministry of Health level, to be ready, because the whole, budgeting aspect is in place. the mechanism to respond, including with the partners, are in place. Hence, by doing this study, which is one of the recommendations of, the real-time evaluation in time of crisis, of course, with the gender lens, is to say, we wish that Bhutan is kind of ready next time, because with the study on public financing strategy for the health ministry, we will have an understanding of where the government needs to put the investment and where partners can come into play. So as we plan for the new country program cycle that we have started now for 2023 to 2028, we are looking at all of these evaluation to support evidence, to say, where is it that, we need to accelerate, aligned with the forthcoming 13th five-year plan of the government? And where is it that we actually need to step back, or maybe what is it that we just do not need to continue? Or what is it that we need to scale up at the national level? And so those discussions happen with the government, but also with our implementing partners on the ground, including NGOs, including civil society organization, and so forth, so that we are together in the planning phase using some of this evidence. Right, so I hope I've answered your question. And so on your question on the gender lens, yes, I mean, gender is not about boys and girls, that we know. And hence, when we talk about evaluating and putting a gender lens, we're obviously looking at the different groups, that are affected in this process. Up to that extent, we've reached to all the different targeted group. Maybe Deshan can help here. My colleague, who was also very much involved in the real-time evaluation exercise. I'm also referring to the LGBTQI community, to say that the data collection tools that were developed for this exercise, were a mix of methodology, from feedback surveys to semi-structured interviews to interactive and interactive peer reviews and focus group discussion and so forth, to the extent possible, acknowledging it was time of crisis and we really wanted to have a sense of what was going on. So many of the kind of questionnaires and discussions were also done virtually, as you can understand. And also the evaluation took into account some of our own, I was explaining, reports, internal reports on, what was going on the ground, how many children were being reached by life-saving, programming, messages, and so forth. So looking at the different target groups, without excluding, the entire gender community, was important. So we have just undertaken now, or we're in the process of finalizing a gender programmatic review of all the UNICEF programs since we have started the country program. And those elements, of looking at the bigger spectrum of the gender lens are going to also be taken into account, so that we program better for the new country program starting in 2024. Thank you.
One more question.
Let's thank you. We still have time to take one more question now. So if anyone has any questions.
Good morning, Madam, and thank you so much for your presentation. I'm Melinda from Royal Institute of Management, and I'm here with my students here. In fact, it's a wonderful presentation reflecting the international report on the evaluation. So I was looking at the evaluation that has taken, you took through the complex situation. But referring to your samples, I was wondering, we had a case, especially during the COVID-19, particularly when we look at the evaluation in terms of inclusiveness that you have reflected. how far did it really capture the crisis, which in fact I would put it beyond complexity, but making it more complicated. And in fact, some of the the issues in terms of gender. For example, we had a mother who actually, in fact, murdered his 3 months old baby. And I don't know how far this particular research or the evaluations has captured the women in such kind of situation during the COVID-19, as well as gender perspective of reaching the data or your respondents as far as beyond the urban part of Thimphu. Did it reach to some part of the remote places in Bhutan, since Bhutan is one of the, I think, country that you have included in your scope? So just wanted to hear about how far did it gone through?
That's a very good question, and I didn't understand the mother part. You mentioned a mother with a small town.
Now I think this mother has been even now I think it went through the court, and then I think she's now in the custody. So what we have been looking at is it is a justice that is given to the baby, in fact, by detaining the mother. But it's a big concern behind the social and gender issue of maybe the economic challenges that mother have faced maybe because of the crisis. So I was wondering that particular case would be one of the factors to get the data of how far the policy is really impacting in terms of gender-based gender lens of making inclusiveness of the a mother who actually maybe forced her to mother her 3 months old baby. So I was wondering, did you do your research looked into such kind of cases, individual cases, or you looked into just collecting the survey, or how did you capture of that inclusiveness of such cases in terms of that mother?
Okay, so this is a very, very specific, peculiar case of one or some of the unfortunate impact of COVID. And of course, the reason why the study was undertaken was exactly for that reason, to help us better program in situation of such a pandemic outbreak that nobody was expecting. Mainstreaming gender in our programming overall in support of the government, but also feedback to the government and implementing partners as to how we can enhance looking at some of these gender issues to support families, vulnerable women, children in time of crisis. And hence I spoke about inclusivity, but I also spoke about equity in the process of the methodology. And when I speak about it, is that the whole methodology and the tools developed were undertaken in the most, inclusive process possible, so that we have representative kind of samples across the country. I'll leave my colleague Deshan to kind of look maybe a bit more onto the technicalities, but the whole process of doing this exercise is to ensure that we remain inclusive, that we remain equitable when we are looking at those different elements, but also to make sure that the findings of the study will help us do a better job in including all of these different elements. So I'll give the floor to Deshan.
Thank
you want to come?
Thank you, Madam Councillor. Just to introduce myself, my name is Deshan Zamo. I work with UNICEF as the Evaluation and Monitoring Officer. Specific to the question that Sir has asked, I think that captures the whole purpose of our meeting today and the topic of our conclave for today. It is a mix. I can see it as a mix of a policy, right? Because if, for example, we have the gender equality policy, that policy should be trickling down to individual cases like this, and it should happen automatically. But here in Bhutan, being a Bhutanese, I'll be maybe a bit comfortable speaking that policies are very good in Bhutan. Perhaps what we lack or may lack could be the implementation of the policies. So if a public policy like gender equality, gender equity policy has been implemented, this should be able to address the, a small impact like this. But for this specific study, it is done at the regional level. Of course, we have consulted the caregivers, the duty bearers, but it will not boil down to one specific case. I would rather think of as looking at the public policy and trickle down effects of the public, limited implementation of the public policies. I hope it's okay.
And just to say, many countries have very good policies. Unfortunately, they don't trickle down and serve the purpose of the population needs and so forth. So when we go into this policy evaluation process, it's showing that we want to improve something, right? So I kind of feel that when we have the courage to say that let's look into this policy and see what is it that we can do, it just shows that there is a kind of a good willingness to improve that policy, being it, on gender issues or anything, for the well-being of the population. And again, just to reiterate, in fact, the study is, for the region, it's a regional study, but our role at the country level is to kind of see how we can take those recommendations and trickle them down at the national level with the government or different counterparts. And so when we do recommendation in any evaluation, of course, we have to also look at the resource aspects of how is it that we're going to put some of these recommendations in place. And because we want to prevent any future pandemic situation where government is caught unexpectedly, we need to look at what we prioritize in the recommendation in terms of immediate actions, right? So, for example, this public health, public finance strategy that is we just initiated with the Ministry of Health is, for me, one of the most important policy tool that we can use to discuss with government how they're going to be working around prioritizing investments and making sure that there are, resources and, infrastructures and you name it in place in case we have any type of pandemic, and not run, to see what to do and where to get the funding and what infrastructures are in place. For example, one key lesson during this COVID-19 was the on the supply chain management part. Many countries, I'm sure you've heard, did receive the COVID-19 vaccine, but they had no storage system in place. So they couldn't manage the cold chain, maintenance. And hence, many vaccines were lost. They had to throw away because of the lack of infrastructure. So what we did here in Bhutan was to work with the government to strengthen the cold chain system in the country. So buying all the necessary equipment, fridges, fridges that can actually, keep the vaccine under -18, high tech, and assess, the EVM environment for Bhutan, build capacity. But all of these elements are going to allow Bhutan, firstly, to be one of the leading countries in tackling COVID, but also to be ready if there is any situation of any pandemic. The cold chain system is one of the strongest now in the region. And so when you do this evaluation and you look at how the response has been made, it's just not the resources, but the human capacity, the infrastructures. All of these are elements that are very important to take into account. So even if the evaluation was focusing on gender, I think some of the elements of the recommendation are important for us to look into, to see where is it that we can holistically improve how we are responding in time of crisis.
Thank you for this interactive question and answer sessions. Thank you, Ms. Mary, once again. Up next, we have Mr. Narbadur Raika. Mr. Narbadur is currently working as a specialist and advisor to the Department of Adult and Higher Education under the Ministry of Education. He has spent most part of his career in the field of teaching and has undertaken many research projects, notably a joint research on teaching and learning at the Royal University of Bhutan with Professor Varun Bell. Currently, Mr. Narbadur also serves as the member of Academic Planning and Resource Committee at the Royal University of Bhutan. He has been elected as the president to Asia Pacific Quality Network. May I now request Mr. Narbadur to speak on the evaluation tools.
Good morning, Honorable Chair, Evaluation Association of Bhutan, Deputy Representative UNICEF Bhutan, distinguished guests, ladies and gentlemen. I'm really highly but humbly honored and privileged to be talking to this August gathering on this topic that is really close to me, close and dear to my heart. It is close to my heart because I've worked for quite some time related to evaluation. That was mainly about evaluating the teaching and learning for the teachers, to be teachers, future teachers. And it is close to my heart, dear to my heart, because it is a subject that is something that I liked all throughout my life that I have served. So it is really a good opportunity for me to share whatever I could do with this group. And when I see the young faces today, I remember my times about 12 years before that, teaching the teachers to be teachers. So I'm very happy that I'm given this opportunity. I'm not sure whether it is really relevant, but it is definitely related to what we would be doing in evaluation. Therefore, what I would like to cover is something about, I called it as evaluation tools. But after submitting this document, I thought maybe I should have called it as quality for evaluation, because Madam Chair talked about equity, Madam Deputy Representative talked about inclusiveness, and with all this, I think we also need to think about the quality of evaluation. And how do you ensure the quality is, of course, we talk about or think about the standards. When you think about the standards, we think about the standards that is of highest quality, and if it is not to the highest quality, it should be at least up to the highest possible quality that we need to think of. That's why how do we evaluate would be my main theme, but there I would like to talk about some of the tools that we could use in evaluation. So I would like to try to give the justice given to me for this half an hour or little more than that. So I would like to talk about mainly what do we mean by evaluation? That is the concept, and then reasons for evaluation, elements of evaluation, process of evaluation, and that takes us to the tools and techniques of evaluation, which is the main theme of today's talk that I'm going to cover. And of course, we also look at some ways, how do we select which tool is the best for this particular evaluation. Okay, so to cover what is evaluation, of course, there are so many definitions that we come across, and now it is just click of the button on your laptop or the mobile. You can come across many, but I picked just one from Pattern, which is quite old, but I think it is still relevant. It says evaluation is a process that critically examines a program. Because I thought you were talking mainly about programs and policies, initiatives. So I thought this would be one of the best. That's why I picked this one. It involves collecting and analyzing information about a program's activities, characteristics, and outcomes. So it is 1987 definition, but still I feel it is relevant because it talks about all those things that we are interested in. The purpose is mainly to make the judgments about the program to improve its effectiveness. I think effectiveness and efficiency are the two key things that we always talk about when we talk about programs, policies, whatever. That's why I think it is important, and or to inform programming decisions. And it is essential part of quality improvement. That's why I think quality is important here. And when done well, it can help solve problems, inform decision making, and build knowledge. So those are some of the things that we would do. And of course, if you look at different types of evaluation that we do, we talk about the process evaluation, we talk about the impact evaluation. Madam Deputy Representative also touched on that a little bit. And of course, the outcome, which is mostly about summative. What is the outcome of the evaluation? So these are the main three things. And why evaluation? I've got about three reasons. Evaluation provides a systematic method to study a program, practice, intervention, or initiative to understand how well it achieves its goals. Second one is evaluation helps determine what works well and what could be improved in a program or initiative that you have taken. And the last one is evaluation helps us develop a deeper understanding of how best to improve the program. So that is what we do. And in the process, of course, there are different processes, but I've taken this, they call 4-step process, 5-step process, 6-step process, 9-step process. So I took the liberty to take this from somewhere, which has got 6 steps process, which talks about engaging the stakeholders, describing the program, focusing on the evaluation design, gathering the credible evidence. I think Madam also talked about evidence-based evaluation, so that is very important. Justifying the conclusions, using the, okay, and lastly, okay, that was the last one, that's why I couldn't read that one. Okay, anyway, under this we have got 4 characteristics and standards. 30 standards are grouped under this 4 characteristics, which are mainly about utility, feasibility, propriety, and accuracy. So these are the things that we need to consider when we think of evaluating things. So firstly, utility takes care of 7 of the standards, which are stakeholder identification. That means when you go for evaluating something, you need to think of the stakeholders. So who would be the best stakeholder? Identifying them. Evaluator credibility. What experience do you have? Are you credible enough to carry out the evaluation? Are you trained enough to do this one? Or do you have at least the knowledge and skills at the least? Information scope and selection. What type of information are you going to select, and how do they serve the purpose? Value identification. What value does it have? Why are you doing that evaluation? Report clarity. When you report, it has to be clear. It has to tell what you found out and what could be some of the recommendations that you can derive out of that, all those things. Report timeliness and dissemination. If you do the evaluation now and wait for dissemination after a year, I think that is not going to be helpful or useful. And finally, the impact. I think this is very important. You need to know what impact has the evaluation that you have taken made. And second one is feasibility, which has just 3 standards. Practical procedures. The procedures that you follow have to be practical, useful, that you can implement. Second one is political viability. Does it affect what is happening politically? All those things you could think about. And one most important thing under this is cost effectiveness. How do you make it effective in terms of cost that you need to spend? And the third one is proprietary, which has got 8 standards. Service orientation. Does it help? For example, earlier, Madam Deputy Representative talked about how do we make sure that we can help in implementing service. Formal agreements. For example, when you engage the stakeholders, you may have to get their consent of using them for taking the information. So that is one example of agreements. Rights of human subjects. You need to consider their rights. For example, if they don't want to share something, I think you should not be forcing them. That's one example. Human interactions. How do you make sure that you interact in a way that they give the exact information that you are looking for? Then complete and fair assessment. How do you ensure that the assessment is complete, comprehensive, fair, that is not biased, all those things. Disclosure of findings. How do you disclose the findings? If it is sensitive, you may not like to disclose that. So you may take even that, even out of the questionnaire that you prepare as one of the tools. So that's one example. Conflict of interest. I think all of us know that we have to also sign the conflict of interest when we engage the stakeholders. Then fiscal responsibility. How are you going to take care of the finance that you need to use? Do you have the adequate finance that you need for taking the evaluation process through? And the last one, which I think is the most important one, I feel it is the most important one. One reason is because it has got 12 standards, highest number of standards. So it should be very important. That is the accuracy. Whatever you find out, it has to be accurate. You have to get the accurate results. You have to report the accurate results, which covers program documentation. Whatever you have found out, you need to document, and context analysis. In what context have you taken the evaluation? Was that good enough? All those things you can analyze yourself and see. Next one is described purposes and procedures. How are you going to do this? The procedures and the process purposes of evaluation, which usually comes through the questions. In research, you do major question and smaller questions, isn't it? So in the similar way, what do you ask have to come through the from the purpose that you have in mind, and what procedure are you going to use for carrying out the evaluation. Defensible information sources. For example, when you report, you need to be clear you need to be sure whatever you are reporting. So if you cannot defend yourself, if somebody asks you, for example, Madam said about the case studies, and you asked for further clarification. If you cannot share, especially if it was your own evaluation, then you must be clear about what you have found out, what you have reported, and you can defend on any questions that come from the audience. Defensible. Valid information. The information has to be valid. You can't just put anything. Whatever you wanted to find out, if you have found out, that is valid. Reliable information. The information that has to be, it is reliable, it is believable, it came out as the consistent thing. For example, when you recommend, you come out from the list of findings that you get, isn't it? And how do you get the findings is based on the things that, the information that you have got from different groups of people. So you put them in the form of findings, then you recommend based on that one. So it has to be reliable. Systematic information. So valid, reliable, systematic, all those are the adjectives for the informations that we use. Analysis of quantitative information. For example, if you say that the research was or the evaluation was done for the quantitative, through the quantitative measures, you may have to involve analysis, even including statistical analysis and other type of analysis. Then analysis of qualitative information. Qualitative information usually you get from focus group discussion, interviews, all those things. And quantitative, of course, usually it comes from the questionnaires that you send out, which I'll share later in the moment. Then the conclusions have to be justified. Only after understanding, you draw up the conclusion. What is the result of your study or the evaluation that you have conducted? Has to be justified. Impartial reporting. There should not be any bias reporting, thinking or saying that you belong to this, so you cannot report on this particular thing, so you would not report it, but you report only on the other areas. So that is biased reporting, which is against this. And of course, meta evaluation, evaluating on the evaluation, evaluating on the results reports that you have got, evaluating further on what you have found out. That is meta evaluation. Okay, next. When you think of evaluation, I think these are the things that you would think of. Firstly, the purpose. Why do you want to evaluate? What is the main purpose of evaluation? That is one very important element of evaluation. And after knowing that, of course, you have the questions. What questions are you going to ask? Starting from the main theme question, going down to specific questions that you would put down in the questionnaire or even in your interview. So those are the questions that you would use. Then criteria. What are the criteria that you would like to use? Mainly, criteria comes from the purpose. So you would select what are the things that you would like to check. Timetable and work plan. I think this is quite, simpler than other things, but very important. You need to work out when are you going to do this and how are you going to do this, including collecting the data and up to compiling and generating the reports. The next one is collecting data for an evaluation. That is very important. How do you collect the data? Then data collection methods to answer the evaluation questions. So this is, I think, this is going to take further closer into what we are going to talk more about, that is the tools and the techniques that we will use. Data collection tools and activities. So again, we talk about the tools, what tools we will use, how do we use, when do we do that, all those things. Then, of course, finally, after collecting the data, we do the analysis and reporting the evaluation finding. Okay. So next, here I just named some of the tools and techniques that we can use. Some of these may be more relevant to evaluation of the programs and policies that we use. Some of these may be more inclined towards evaluation of even teaching and learning, but I think we can use all of this and try and use all of this in evaluation. First one is, of course, questionnaire. We do the questionnaire and prepare the questionnaire and then distribute the questionnaire to them, to the participants, and get their responses. Next one, very important one, is the interview. We talked about interview, and interview usually has to be one-to-one. Third one is observation. You may also observe things which are happening and derive the ideas and evidences from the observation that you can make. Fourth one, very specific rating. We call it a rating scale, like how happy are you? Are you very happy, very sad, somewhat happy, somewhat sad, moderately happy, all those type of things. We get put in the form of rating scales. Then next one is the checklist. Of course, checklist, I think this is one of the least used tool in evaluation of programs and other things, because this is mainly for, I think, finding out what you, okay, thank you, what you need to do. Then attitude skills. This is one thing that I think we use quite often. Then self-report or diary. This is less, but I think sometimes we note things. Anecdotal records is also something that we can use. Okay, questionnaire. I think these are some of the things that we will do. Most commonly used ones is this ones, because we get the individual response from the questionnaire. Self-administered based on the instruction that you put in the questionnaire. So questionnaire has to be clear enough, most cost effective, because you don't spend more time. You can just send the questionnaire out and let them answer those. And therefore it has to be, the development has to ensure that it is simple, clear, and concise. And of course, it is mainly for the quantitative test. And if you go to the interview, it is mainly for the qualitative, and therefore it is second most important one that we use in our evaluation process. And of course, it can also be used for quantitative testing. And it can be done in a group, like Madam mentioned about focus group, or it can be done individually. And it has to be based on convenience of both the parties, so you have to come together, so it is a little difficult. And other things, I think we can skip for now. And observation is something that you can observe and see. I think I'll leave this out. Next. Rating scale checklist. Again, I can skip this. Attitude scale, I think this is very important, but you can see that it measures the feeling, whether you agree on that or not, how well you feel. And usually it comes in the form of, for example, for one issue, you might have a list of 10 to 15 smaller things that you can do, check from the attitude. Next. Self-report, diary, anecdotal notes. These are just to keep the notes of heard about, what you have observed, what you have seen, all those things. So I think this is okay. Now, the last one is, when you talk about selection of tools and techniques, these are some of the things that you need to remember. It has to be valid. The tool should be able to measure what it intends to measure. That makes it valid. It has to be reliable because it has to be, therefore, it has to be consistent. So to see the consistency, usually what we do is we test the tool, we pre-test the tool, we test the tool, use it many times, and then see whether they give the same results or at least the similar results. And if we get the similar results, then it is reliable. Then, of course, appropriate, comprehensive. I think, as I said, whatever you wanted to find out, it has to be comprehensive and cost-effective and time-saving. Of course, that is in your hands how you would like to plan out. So this is all that I would like. Sorry, I have got. Next one is, I think, just the last one. Katin Sela. Thank you. If there is any questions.
Plus, thank you, Ms. Kannar, for highlighting the what, how, and why of evaluations and the common tools and technique used. So, do we have any questions from the floor?
Yes.
Thank you so much for the enriching session. I am Tashtenzin, a PG trainee from Royal Institute of Management. Thank you so much for the wonderful session. So my question here is, since Sir hails from the Ministry of Education, particularly, I think it's given here in the paper that Sir served as a specialist or the advisor to Dahi. So it's pertaining to the scholarship program that is offered by Ministry of Education, which is especially the Dahi, right, sir? So I want to ask question whether while Ministry of Education, especially Dahi, while offering the scholarship slots, like give me example of my own program. I studied Bachelor of Pharmacy in Ayurveda, and there are many other courses like naturopathy and yogic science, Bachelor of Forensic Science. These are the courses that are being offered after the completion of class 12. And is Dahi and the Ministry doing proper evaluation whether the particular course after being completed by a student, will it have some kind of impact? In fact, will that particular student gets the gainful employment? Since I'm one of the victim of that particular scholarship, I just want to ask, after government have spent around 1.1 million into me, I'm not able to do anything out of my 4 years of study in lovely professional university. So if Dahi is doing any proper evaluation, since Sir said that evaluation means properly examining. So if Sir have anything to say on it, thank you.
Yes, I hope this is relevant because you connected with evaluation, whether we have done the evaluation or not. I think for the purpose of answering this question, I know the difficulties that you have faced. We have to take to different forums, trying to make sure that what you have learned is what you have learned must be considered for your employment. But what we see now is you're in a different field. So I can understand that one. How that happened was, I think it has, actually it was through the Queen's endowment, isn't it? So I think that was not evaluated properly. Yesterday only we celebrated the wedding, and it came in 2013 that some of these programs would be more of, how do you call this one? Ayurveda is one, music was another one, Pali is another one. All those type of courses were selected for sending the students to study. But when you came back, we found out that the program was not recognized by the body that takes care of medical fields. I think that was the reason. So it is not really about based on evaluation in this case, but it was like ad hoc program. That's why nowadays we send less, and we really make sure that whatever we send in the field of study for a scholarship, they go for more employable courses. So I think it has been taken care. But during that time, when you went, I think it was not really based on the evaluation. I hope I answered your question.
Thank you.
We'll take one more question, but we'll keep it very short later.
No more questions. I think they know that the time is up. Okay. If there is no question, I think it's okay.
Thank you, sir. Thank you, sir, for your interactive presentation and question answer sessions. With this, may I now call upon Tashi Chudin to give the closing remarks.
And good morning, everyone. Good morning, good afternoon, and good evening to those participants who are joining live with us from all over the world. I'm Tashi Chudin, the co-leader of Evaluate Bhutan, and I would like to take this opportunity to express with great honor and privilege our heartfelt gratitude to everyone involved in making these sessions a grand success. We are grateful to the speakers for not only sparing time of their busy schedules, but for going above and beyond to evaluate on the knowledge that are aligned towards the essence of evaluations by defining the how, what, and why of evaluations. We are pleased to carry on and implement the importance that were given on evaluations and try our level best to meet the expectations of everyone involved. We would like to thank the community of evaluators for their great support, as always, for being a constant support during the entire event and for everything we could achieve so far. Thank you to all the participants for sparing your valuable time and for being a wonderful audience. And I would like to request the same amount of energy and interest to all the activities that we have planned throughout the day. Thank you and Tashtele.